we know very well, as science has proven, they have deleterious effects or quite serious effects on that particular population. And I'm happy as a nation we have made a lot of progress. We have been able to move from a prevalence of over 30% now to just 5%. Lakini it is important that I specify that this 5% is not uniform, and you may find there are some counties or some populations that are heavily burdened by these ones with quite high prevalence of upwards of 40%. And that's why you find for this national event, as a ministry, we are covering the high burden counties nationally, and we are targeting over 6 million pupils who are going to be treated today to be able to free them from the burden and the effects of worms. Worms usually affect the nutritional status of our children. Worms usually impair the concentration and the cognitive performance of our children. Worms also are not only a burden to the children themselves, but also it is an issue of hygiene that we can be able to handle. Because for us to be able to eliminate worms as a nation, we should be able to cover the issue of good hygiene, being able to cover and improve our sanitation, which we are doing from all fronts, and also at the same time be able to give very safe medication that is locally produced and supporting local manufacturing. And these are very simple tablets that have been proven to be safe and be able to keep the children free from worms. So mine is to be able to thank everybody, and I know our leadership is on top of this because it's a commitment and it's part of our SDG 6 to be able to eliminate worms within our population. There are countries that have been able to eliminate worms successfully, and worms are not new. They've been there since time immemorial, and I can say publicly that the first health system that has been organized or that has ever been organized in terms of humanity was actually organized towards eliminating worms, because when you eliminate worms, it basically brings together all the building blocks for a health system. And if you can eliminate worms in a population, then you can very comfortably be able to eliminate any preventable disease within certain populations. So it's a big step. We have made quite a lot of milestones as a nation. We are quite proud of this event that is happening today, that will be able to reach our population, which is the most vulnerable, because again, I remind us that this is the population that is most vulnerable, but also the impact of worms within this population is most deleterious within the population. That's why we are targeting our school age children from 2 years to 14 years, both within the school and environment, and those who are outside the school, so that we're able to reach them. And we are targeting those ones who are quite affected with a high burden, the 6 million pupils. By the time we do this drive between now and Monday, we do hope that we'll have reached, and we are on course to reach the target of 6 million pupils going forward.
We want to leverage on the teachers that we have. We have trained a number that is approximately 28,000 teachers that have been trained very well by our colleagues from the Ministry of Health. So in this context, the Ministry of Health officials have become teachers, and the teachers have been turned to be medics for this time that we need them to take part in treating the children. We know that the child has a lot of trust on the teacher, and therefore a teacher that has been trained and has been given the abilities to treat, then can treat well, because the child knows the teacher, and then we are going to gain more by use of our teachers. I want to thank the Ministry of Education officials, right from the regional directors in the 16 targeted areas, who have come together with the county directors of education. We have our county director here in Kirinyaga present, and our regional director represented very well by Mr. Kagiri, and all the others down to the school, the sub-county directors and our teachers. We are happy because they have been mobilized well, they have been trained. And we know that today, as we start this exercise, all our children in school are going to be treated, and we want to use the school also as an avenue where we will reach the community and treat the children within that age of 2 to 14, so that we eliminate these worms totally. Because if we treat the ones that are in school and you leave out the ones in the community, again the worms may get back to the people that we have treated.
We are here for the national launch of the deworming program, school-based deworming program, which is happening in 16 counties. of this country, which have a high burden of worms. And basically, our slogan is kwa afya na elimu bora, tuangamize minyoo. And we believe through schools we can be able to change our populace to embrace those very, very behavior, the sort of behavior that was geared towards eradicating minyoo or worms amongst our population, especially the children who are the backbone of this country and the future of society. I want to hail the partnership, the Ministry of Health, who offer technical support in terms of the treatment of the drugs themselves. The Ministry of Education, through which we are writing the agenda through the schools, and therefore to embrace the partnership of Ministry of Health. Of course, the county government, where the health is enshrined in terms of devolution. And of course, partners like KEMRI and Evidence Action, prominently presented here by Mr. Owaga. And we are very happy about partnership that we are getting, and it's very, very good. And this all is about one government approach. As a government, we embracing both sectoral approach in terms of sorting the problems or issues in the developing society that are going on throughout the 16 counties of our republic to ensure that we have elderly children who can concentrate and take their studies seriously after we are sure that we are able to eliminate worms amongst them. And this is a follow-up of the gain we have got so far from the 3% to 5%, and we want that figure to go lower because 5% is still significant, and therefore if we can be able to bring our concerted efforts from these stakeholders, then we are able to wipe this problem from our population.
Kenyana County being a national launch for deworming of our children. As you may be aware, is that Kenyana County is one of those particular counties that has issues to do with bilharzia because of the plantations that we have in Mwea irrigation scheme. And again, we have had issues of sanitation, water and sanitation, and therefore you find that in those particular areas that we have these issues, we most probably there are those particular soil helminths or worms that need to be eliminated from the children who are below 14 years. And therefore we are so grateful because we have been able to collaborate with the Ministry of Health, the Ministry of Education, that is the national ministries, and also we've been able to collaborate with the County Department of Education and the County Department of Health. And for that particular reason, we've been able to train, for us specifically, about 680 teachers on this particular exercise. We have also engaged our healthcare workers. About 84 of them have also been trained and supervising all the primary schools where this exercise is taking place. And we have said that it is not anything new that we are doing. We have been doing this, but this particular time we have said that we must have to do it in a large scale so that we cover the whole of the county, and that is exactly what we have done. Otherwise, it is a part of our business as County Department of Health and Ministry of Education to do collaboration so that we can deal with issues health in schools and also our children. As you have heard, is that children, when they have this kind of infections, their performance is also affected, and therefore they may not be in a position to concentrate in their class. So therefore we are also improving. When you do this particular deworming, you also improve attendance of class and also, admissions in schools.
The celebration of working together. As Evidence Action, we support the Ministry of Education and Ministry of Health in terms of a national school-based deworming program. We have been in the space since 2012, and we continue with our commitment. We are very excited for the launch today. As I have said, it's a celebration of what collaboration can do. National level Ministry of Health, national level Ministry of Education, county governments at Ministry of Health and Ministry of Education. We are pretty excited. We hope that this round will be able to reach about 6 million children in 16 counties. What is critical for us as Evidence Action is that we primarily support programs which are very cost effective, and in this particular program each child is treated at less than 50 shillings as their cost of treatment. We also support programs which are large scale. As I have said, we are targeting about 6 million children, and all our programs are evidence based. We continue to have this commitment with the government of Kenya, and very excited so far where we have been. we know we have had a very significant reduction of prevalence, and we are excited about that. And in this particular phase of sustainability of the program, we are hoping that the government will take up a majority of the work that we have been doing as we move forward, so that the gains that we have made over time are sustained.
Na tuangamize minyoo, si ndio? Asanteni kwa utazindua.
Kunywa dawa ndio? Punguze nini? Minyoo, simama basi. Ndio? Na short like me. Okay, that's a good one. Meza.
Tembe hiyo kwa mwanafunzi wa pili. Asante.
And something we should note before we beginning this exercise.
Sasa tuko karibu kutoka. Na hawa mnaona hapa sasa 2004 Dr. Paul Gichuki. Nafikiri atasimama sasa, tunafanya naye mambo ya utafiti wa deworming. 5%. That is an achievement. Lakini nilisema tulipofanya kazi Mwea, tulifanya kazi nzuri sana kwa miaka mingi. Nataka tu nimkaribishe Dr. Doris Njomo ambaye tushafanya utafiti na yeye mambo ya deworming kwa muda mrefu. Sasa tuko na national program. Hii program imeenda vizuri, wanakuja hapa kuangalia vile tunafanya mambo yetu. Lakini vile nimesema na wakati tulifanya kazi nzuri hapa Mwea, hapa Kirinyaga.
Ukunywe hii dawa, minyoo iagamizwe, ukuwe mwanafunzi.
Tunaita albendazole, tunapeana katika age brackets tofauti tofauti. Dawa mbili kuangamiza minyoo for this exercise. Na
ambayo imeshikilia sana mambo ya deworming. Na zamani wakati huo 2004